I basically live in the ICU. So I've actually worked 42 hours every other day for 6 months. And I've also worked about 140 hours in a 7-day period. Those were the longest shifts that I've ever done.
Yeah, the longest shift I've ever worked was 31 hours as a medical student, and that was very grueling to say the least. As an attending, probably about 18 hours, and that was because of a code situation that I just couldn't walk away from. So
34 hours, I think, is the longest I've ever worked. And in that 34-hour stretch, I don't think I slept a single minute. I remember going to the call room thinking I would get a couple of minutes, and then of course the pager goes off because the ER has another admission for you.
So one of the hardest parts of being a physician is a lot of times you have to deliver very difficult news. And because we are human beings, and I consider myself very empathetic, a lot of times I also have very similar emotional reactions. And so it does affect you. It's not just a job. It's not just, something that we check in and check out and walk away. And so a lot of times we feel very similarly as the patient or family when we deliver very difficult news, unfortunately.
It wasn't until I started residency that I truly understood what it meant to be a doctor. It was those harrowing 36-hour calls. It was seeing families in tears because their loved one was reaching that final phase in life. It was seeing young people like my own age in my 20s suddenly facing a health crisis that they never expected at this age. I realized that being able to give somebody comfort in that period of time, like being able to answer questions, to give them that information and that peace of mind that truly let me know what being a physician really meant.
I would say the demand, especially when you're in the clinical setting, some of those things can be life or death, and so you need to stop, and drop whatever you're doing to deal with that. But it's rewarding at the same time, especially in those life and death situations, whenever you're able to intervene.
And sometimes being a doctor is a thankless job, but that's okay because you realize that by giving someone that chance of health, every decision that they make from that point on in their life, you played a part in that.
Being a doctor gives you the opportunity to really speak on a very deep emotional level with somebody. I would say that is one of the biggest things that I like about being a doctor.
I love what I do, especially with alignment, because we have so many opportunities to assist our membership. There's such a robust healthcare team. We are truly a healthcare delivery model that does talk the talk and walk the walk, and we're here to support the member.
Because what I realized that our company does very differently is it treats our members like human beings and not as names and date of birth. I got a call to our clinic. The member asked for me by name, and she was just so impressed that, again, we treated her like a human being and not an authorization number. So I think doing those kind of things to empower these members and being involved in their lives, getting to know who they are, it's a wonderful thing. And I never thought that I would get that working for a quote-unquote insurance company. So I find this job stimulating every day, and I wouldn't trade it for the world.